In this video today, I'm going to give you the 9 things I recommend everyone needs to know about their poop. Let's begin. For those of you guys who are joining me for the first time, my name is Dr. Samir Islam. Yes, I am a poop guru, and my passion is to give you tips and tricks to help out with your gut health. If you're new to this video series, I would encourage you to subscribe down below. At any point in time during the video, click on the show notes down below where I have my links about some of the topics that I'm going to talk about. But in this video today, I'm going to talk to you about the 9 things I want you to know about your poop. The 9 most important things that I think everyone should know to hopefully understand what your poop is about. So the first thing I want you to know is actually what is considered normal. A lot of people ask me this, Dr. Islam, am I having a normal amount of bowel movements? Is it okay to go to the bowel to have a bowel movement every couple of weeks? And I can tell you what we consider to be normal is anywhere between 3 times per day to 3 times per week. And that's a wide spectrum of what's considered normal. And that's okay. If you fall in within that spectrum of having a bowel movement, that is considered a normal bowel movement. It is okay sometimes to go more than that, and it's okay sometimes to go even less than that as well. But that is what we consider the scientific definition of normal. Now, a lot of this depends on a lot of issues going on in your life, whether you're having constipation, whether you're dehydrated, whether you're traveling. It really just kind of depends. It also depends on your lifestyle and your body as well. I have some people who are more active who go to the bathroom more frequently. I have a lot of other people who are less active who may not go to the bathroom as much. And so don't be caught up in what is normal or not normal. I can tell you, don't even worry about that. It's more important to see what is more comfortable for your particular body and your particular lifestyle. The second thing I want you to know is how stress really affects your bowels. It is very important to realize that when you're stressed, if you have a lot of anxiety, maybe even depression, this can really affect how your gut is, whether it's dealing with heartburn, constipation, reflux, and diarrhea as well. There's a significant connection between your brain and your gut. It's called the brain-gut axis. A lot of the ways that our brain can affect our gut, if you're more stressed, you may have more bowel movements, or if you're more stressed, you actually may be constipated, and vice versa as well. It ends up being a vicious cycle. So keep in mind that stress really can affect how you feel. And so for a lot of our patients, we actually deal with their stress, and in turn, that can really make their bowel habits a lot better and more effective. There's also a significant link between stress and a condition called IBS, or irritable bowel syndrome. A lot of my patients who have IBS also have stress. A lot of my patients who have anxiety also have IBS as well. And sometimes one of the more effective treatments we have for that is by giving you medications or lifestyle changes to help out with your stress, which in turn can help out with your IBS. The next thing I want you to know is that probiotics may improve your bowel habits. Now, I stress the word may because there's not a lot of good scientific evidence to suggest that probiotics can help out with everyone. And there are some conditions in which I do recommend taking a probiotic, but some people, it may actually help out with your gut issues, whether it's dealing with diarrhea, constipation, or IBS. So my recommendation is to try a probiotic, try it for a few weeks and see how you respond. I've had some patients tell me that they feel wonderful being on a probiotic, but I've had other patients tell me that they don't notice any difference. So use a trial and error to see what is going to be the best for your particular body and your condition as well. But don't feel obligated to try it. If you tried it for a couple of weeks and it doesn't work, then forget about it. Don't have to worry about it. Water is such an important part of bowel health. A lot of people just don't drink enough water, and this is maybe the reason why they're having some of their gut issues. Try to aim for 6 to 8 cups of water per day. Now, this can depend on a lot of different factors, whether you are exercising, your body habitus, how much activity that you have, but on average, 6 to 8 waters per day can really make a big difference in terms of having you go to the restroom more effectively and use the restroom easier as well. Eating breakfast is an important part of the GI tract. It triggers what's called the gastrocolic reflex. It actually wakes up your bowel system. So for a lot of my patients who have bowel issues, one of the easier lifestyle things I recommend is to try to have breakfast. Actually have a breakfast. Don't skip that. Whenever you eat breakfast, it triggers your stomach to work. That in turn puts down a reaction down to your small intestine and down to your colon to cause contraction to occur. This is called the gastrocolic reflex. And for a lot of my patients who have constipation, by starting breakfast you're actually initiating that reflux, which in turn can help you use the restroom a lot easier. And this is why whenever you have breakfast, you have the urge to go immediately. A lot of people tell me that they have a lot of bowel movements in the morning, and it is because you are simulating your gastrocolic reflex. I am a huge advocate of the Squatty Potty. I think it works, and I think it actually has a very good clinical evidence. I have a couple of videos on the Squatty Potty, and I do recommend this, especially for those patients who have constipation, more specifically who have this condition called pelvic floor dysfunction, in which the angle of the rectum is impaired. And for a lot of my patients who have this issue, they complain of constipation despite using Miralax, fibers, or even medications. It's because the angle of the rectum is impaired, making it more difficult to use the restroom. What the Squatty Potty does, it helps to change that angle to make it normal again, like a slide, to have you have a more effective bowel movement. So if you're having constipation, I really do recommend the Squatty Potty. And the main reason the Squatty Potty works is that it actually helps to elevate the feet so that you're not at a 90-degree angle. It makes it more of a elongated angle to have you have a more effective bowel movement. Now, a lot of people ask me, Dr. Islam, my dad has had GI issues, my mom has had GI issues, will I have GI issues? And the answer is that that may be the case. Now, there are some conditions which are inherited. So there are some genetic predispositions to conditions like ulcerative colitis or maybe in Crohn's disease, but there are some conditions which are clustered in families that they don't actually have a genetic component to it. Things like IBS, constipation, reflux. Now, these are actually not inherited from one person to another, but they tend to run in clusters inside families for patients who have these other conditions as well. So don't be surprised if you have a family member who has a gut issue that other family members may have that as well. It's not necessarily inherited, but there are some conditions which tend to run in families. But also keep in mind, just because somebody has it doesn't mean that you are obligated to have that condition as well. One person has it doesn't mean that you have to have it as well. And there are a lot of lifestyle things that you can do to help prevent that from happening. And we know that for sure GI issues have increased over the decade. We know that as we get older, there are more and more conditions that occur that can make things a lot more difficult for you to have a good effective bowel movement, whether it's constipation, diarrhea. The slowing down of the GI tract can occur as we get older as well. There may be other factors that could be blamed, including a higher use of narcotics as we get older, pain medications, and also as we get older, we're not as active, we're not as mobile, and that can cause things to slow down, making symptoms of reflux, IBS, and constipation worse. One of the most effective things that you can do to improve your bowel health is to make significant lifestyle changes. I talked about increasing water, but also increasing your dietary fiber and also exercising. These simple things that people don't do can make a huge difference in making your symptoms better, making you feeling better, and to control some of the gut issues as well. So if you're having bowel movement issues, try to do these 3 simple things to help improve your bowel habits. So my question for you today is, what changes can you make to help improve your bowel habits? Have you already incorporated some of the recommendations I have? Are there other things you're going to try? If so, I would love to hear down below on what you guys want to do to help improve your bowel habits. I want to thank you guys for joining me today. Every Tuesday at 6:30 a.m. I do a Facebook Live where I try to delve deeply into a topic of your choice. And also every Thursday around 7:30 a.m. I do my Poop Tip Thursday, where I try to drop one poop bomb for a week to help out with your gut health. If you like these videos, I'd encourage you to follow me on social media. I want to thank you guys for joining me. Hope you guys have a great day. Thank you guys for watching these videos. Click here to watch more videos, and click here to find out about more tips to help out with your gut health.